Okay, so here's the question. Why are some communities hit harder than others when it comes to healthcare disparities? It's time to talk about it and to get some answers. Well, I'm joined by Joanne Foster Bishop, the chairman of the Health and Wellness Ministry at New United Church. Hello, Miss Joanne. How are you?
Hello, I'm well, thank you.
So what can people expect who come out and attend this conference, this Healthcare Disparities Conference?
So we have some wonderful speakers that'll be coming. We have Dr. Andrea Willis, who is the Chief Medical Officer at Blue Cross Blue Shield of Tennessee. She will be our keynote speaker. And we have a couple of other speakers that are local speakers. Dr. Willie Hubbard will be talking about her experience and her journey with a transplant. We also have Mr. Edgar Patton, who will go over and talk to us about maternity disparities.
Right, and something that he knows all too well.
Yes.
And you know, when you think about this and the keynote speaker and Dr. Willis, talk about just kind of the message that they are bringing and, you know, the discussion that they'll be having with those in attendance.
So Dr. Willis has a lot of data that she has gotten on the Tennessee disparities, especially among our African American population. The data will show where a lot of access to care is one of the things that mostly is the big thing that our population has that we need to make sure that that's there for them. Also, we'll have Dr. Willie Hubbard that will talk about organ donations and about her journey with her organ transplant that she got. That's a disparity where a lot of our African Americans especially receiving transplants, but they don't sometimes they do not understand the need of being an organ donor too. So we'll have someone there to talk about that. And then the maternity disparity, another thing, mostly education, making people aware that there is a maternity disparity, but also giving them the information and the resources. We will have some vendors there also that will go over some programs that they have.
And I think, again, Joanne, it's about educating people, as you talk about educating and empowering people, because if they don't know what steps to take next, then, you know, you can't start to solve and resolve this issue. And when it comes to health care disparities, and you talk about the minority communities, you know, you're more likely to see when you look at the trends and the data of dying from certain diseases, of even getting certain diseases, and suffering at a higher level. And so you look at why is that some people do better when they're diagnosed with something than others. And one of the things, Joan, you hear a lot of times is because they come in and it's far gone a lot of times, or they don't make those regular appointments at the doctor.
So wellness is a big thing. The wellness piece of it is what you just said. Going and getting your checkups done, getting your mammographies done, you're making sure that you know your blood pressure. You have a primary care doctor that you're going to on a regular basis that can keep track of your health as you are going through your different age groups. So that's a big thing. And then with our maternity is making sure you're following up on those OBGYN appointments. Knowing about what's going on with your body. And that's a big thing because a lot of us, we feel fine. We're walking around, we feel fine. So we don't know that maybe our blood pressure is up or our blood sugar is up. So it's important to go to your primary care doctor.
And that is, so again, like you said, be proactive, not reactive.
Yes.
You see now so many more, like, you know, you are over the Health and Wellness Ministry at New United, and more churches are getting involved and making health and wellness ministries a big part of what they do. How important is that for churches to make sure that their members are not only spiritually healthy, but physically healthy as well?
Absolutely, physically and mentally healthy. That's a big thing because that's another disparity that we see in our community is mental health. So it's important because our pastors are looked upon as being someone that our population, no matter what, looks up to. And if they tell them and explain to them about how important it is for wellness and health and knowing about your health, then it makes it to where we're putting it in a environment where our community feels safe. and they feel like this is the information they need to know.
Well, that is so important. And Joan, so just remind everybody like when this conference will take place, where, and how they can take part.
So we will have the conference from 10 a.m. to 2 p.m. That'll be on September the 21st. It's a Saturday. We will have food. Everything is free. We'll have door prizes. And also we have brought into the conference, this is the second annual, we're going to be acknowledging some of the people in the community that has also worked very hard with healthcare disparities. This first year, our recipients are some of the founders of the Minority Health Fair. Mainly, they get out there every year and do a wonderful program to where people can come and get some of these health disparities taken care of. So it's important that we acknowledge them, and they will be our first recipients of this award.
Okay, so well deserved, as you said. And thank you so much, Joanne, for being here. And we'll remind people that they can take part in that conference. There is the information coming up.